Good afternoon, dear patients. Today we are going to discuss a specific clinical case involving a male patient who recently came to our clinic presenting with unusual rashes on his lips. This occurred shortly after he engaged in cunnilingus. He explained that he was specifically having oral sex with a female partner, and he noted that this encounter did not involve his own genitals at all. Approximately 5 days after this event, he began to notice the development of these persistent rashes around the area of his lips. By the 3rd day of experiencing these symptoms, he decided it was necessary to come in and see us for a professional evaluation. So, we can see these blisters and erosions on the lips, which are generally most characteristic of herpes and sometimes of streptoderma. You can watch a separate video on our channel about what herpes and streptoderma are. Given the suspicion of these two conditions, cultures were taken from the area of the eruptions from the erosions, those covered with yellowish crusts, for bacteria, and accordingly samples were also taken from the surface of the eruptions for all types of herpes, that is type 1, type 2, and shingles, herpes zoster. Well, as a result of these tests, herpes simplex virus type 2 was identified, that is genital herpes. A blood test for genital herpes was also performed. At present, it is negative, which indicates that he was infected with this herpes relatively recently, apparently during this particular sexual contact, because immunoglobulin G, M, and PCR blood tests for herpes were negative. You can watch a separate video on our channel to learn more about what immunoglobulin G, M for herpes are and about herpes testing. So, accordingly, this is a recent genital herpes infection, and it shows that even with such urogenital contacts, one can also contract sexually transmitted infections. The entry of genital herpes into the body, even if it's on the lips, can quite possibly lead to outbreaks in the genital area for the same patient. These outbreaks, this type of herpes, tend to recur more frequently compared to type 1 herpes. Accordingly, this patient received standard therapy, interferon therapy, antiherpetic medications, ozone therapy, and so on. You can watch a separate video on our channel to learn more about the treatment of genital herpes. As a result, these kinds of outbreaks resolved. However, later on, we observed that this patient's blood first showed immunoglobulin M and then immunoglobulin G, which indicates a gradual immune response in the blood to herpes infection. Therefore, of course, in this case, we cannot talk about any kind of protection. It is essentially impossible to protect the mouth during cunnilingus. Generally, if your partner is infected, including with genital herpes, you can also contract, for example, gonorrhea, chlamydia, and other diseases. You can watch a separate video on our channel about infections that can be transmitted during such contacts. Of course, the best prevention here is having a regular sexual partner for such contacts because, as I already mentioned, there is no reliable prevention in terms of contraception, especially if it's a woman, for example. As for if you had unprotected oral sex, either cunnilingus on your part, or for example, a man receiving oral sex and it was unprotected and you don't trust this partner or the condom broke, then it's best to undergo preventive treatment after such a casual sexual encounter for all sexually transmitted infections, which, by the way, includes genital herpes. If the young man had undergone such preventive treatment, then with a 95 to 99% probability, he would not have had these kinds of outbreaks. So in such cases, there is only one solution: medication-based prevention after a casual sexual encounter.